Hello, I'm Jeff Rouse. It's my pleasure to introduce an elite member of the American Academy of Restorative Dentistry, Dr. Tal Morr. Tal is in the private practice of prosthodontics in Aventura, Florida. He received his dental degree from Tufts University and his certificate in prosthodontics from the University of Washington. I had a wonderful opportunity last month actually to see Tal lecture. And I have to tell you, he is creating beautiful, sophisticated, and as you will see in a moment, intelligent dentistry that I think all of us will have as a level to aspire to. His topic is surgical versus prosthetic options to achieve ideal tooth and soft tissue form. Dr. Morr.
Good afternoon. Can everyone hear me? Thank you very much, Jeff. I just need to figure out, the green is forward, I assume. Okay, so I want to thank you very much for having me today. It's really an honor and a pleasure for me to be here, not only because I'm a member of this academy, but because so many of my friends and peers are here, my fellow at University of Washington grad students and my mentors, such as John Coyce. So for me, it's like going back to school, and it's very exciting. You've heard what the topic is going to be. It's surgical versus prosthetic options to achieve ideal tooth and soft tissue form, but we're going to focus on implants because of the limited time that I have. When you ask yourself, why is the pink important? It's important because you know that the pink helps to define the cervical contour of the teeth, helps to define proportion, and give the overall symmetry to the smile. Therefore, it's critical in the aesthetics. And if you look at the literature, it shows you that the papillas are visible during smiling 91 to 100% of the time. And if you live in Florida, it's 100% of the time because we have what we call lip lifters, where they lift their lip and look underneath and show you exactly what's going on. So in my practice, it's 100% of the time. And there are basically three pink aesthetic scenarios that present to your office. The first being the one in which the pink is ideal or close to ideal, and ideal aesthetics can be achieved with some form of white restoration. The second one is where the pink is manageable with surgery and or orthodontics, and this involves either teeth or implants. And the third scenario is one in which the pink is unmanageable. Surgery is not predictable, or the patient has very high expectations. You need to consider something like artificial pink. So the question is, how do you differentiate between the manageable pink defect versus the unmanageable pink defect? Because as dentists, we have to relay the information to the patient before we jump in and treat the case, only to find out that we may have a problem later on. We need to prepare for any scenario. So I think it's important that we talk about the surgical biologic limitations, and today Brahm and Sonia did discuss that this morning. So if you look at the situation where this patient's going to lose tooth number 8, you see there's a fistula on the facial. If you look radiographically, there's a very large defect. The surgeon opens this up and you see that there's a large defect. And after extracting this tooth, there's no bone on the mesial aspect of the lateral. So as Sonia and Brahm discussed, the biologic limitation for vertical augmentation of bone is what? The interproximal bone, the interproximal peak of bone. And given that this peak of bone is 7 millimeters apical to the papilla, we know that as a result, because the lateral is one of the teeth adjacent to that implant that's supporting the papilla, we're going to lose that papilla on that side. So we can go ahead and graft that bone. We can go ahead and place the implant, finish the restoration, and of course the patient is happy. But if you look critically, you'll notice that there's no papilla on the mesial of the lateral incisor. But that's biology. That's what happens in real life. So based on that, we have to have a pink diagnostic evaluation for implants so we can tell the patient up front what's going to happen, whether it's going to be successful or not, or what type of restoration you can promise that patient to be successful. The question you have to ask yourselves are whether the papilla are ideal. And when I say papilla, I mean the interproximal bone and the soft tissue. It's actually the complex, including the supracrestal fiber attachment that we heard Jim talk about earlier. If the answer is yes, you can go ahead and do your bone graft, connective tissue graft, or a combination of the two to rebuild the deficiency, which is generally in the facial aspect.